As we age, our bodies change and it can affect our sexual health. But now you can help turn back the time with a new vaginal treatment. And to tell us more, we're joined by Dr. Christine Marasini. Thanks so much for joining us today.
Thanks.
So let's talk about women and as we age, how our body changes.
So as we age, and get closer to menopause, we start to lose our estrogen, and that creates the lining of the vagina to thin out. Mm-hmm. It becomes thinner, less elastic, more fragile, and it tears easily. So this results in feelings of vaginal dryness. They get stinging and burning, and then they have pain with intercourse.
So what kind of treatment options then do women have?
So traditionally, we really only have had vaginal estrogen creams and tablets to help build up the lining of the vagina. And the problem with those is that they often have not been well covered by insurance. And there are many women that can't take estrogen. If they've had a estrogen-dependent cancer, such as breast cancer or endometrial cancer, or if they've had a medical problem such as a stroke or blood clot, they're not candidates for estrogen.
I can imagine, too, with the tablets and everything like that, that might be kind of gross.
Yeah, it's just kind of messy. It is. People have to put it in the vagina twice a week, and it's just, bothersome.
Gotcha. And now you have something called FemiLift. This is a state-of-the-art machine. Tell me about how this works.
Yes, it is a new machine. It's a great procedure that treats the vaginal lining to encourage cell growth of the vaginal lining. It encourages collagen growth and blood vessel growth to make the lining stretchier, and they then have reduced symptoms of vaginal dryness and less pain with intercourse.
Now this is fascinating. How exactly does it work and how often do you need to have it done?
So it is a CO2 laser. It's a micro laser that makes small little defects in the vaginal lining. And then this encourages your own body to produce more collagen cells, more blood vessel cells to thicken the lining of the vagina and make it more stretchy and help it to produce more natural lubricants.
And how many times do you need the treatment?
So it is a 3-treatment procedure done once a month. Each treatment only takes a few minutes, but you might allow 30 minutes from start to finish. And women will see an improvement after the first treatment and more after the second, but most after the third treatment.
And is that then 3 and you're done for good?
Well, it's not a complete fix. We do think that the lining of the vagina thins out with time. So typically in a year, they may need a touch-up procedure, just one additional procedure each year.
Now, can any woman get this?
Well, it is really for women who have vaginal dryness from the loss of estrogen. And this may be from natural menopause, or it may be from surgical menopause if they've had their ovaries removed, or if they've had chemotherapy for cancer and that has turned their ovaries off. So for any of those women, this would be a great option.
And let's talk about insurance and things like that. Is that something that's covered under this?
So it's not covered by traditional insurance, but women can use their HSAs, their flexible spending accounts for it. And if you think about the cost of the vaginal estrogen creams and tablets, it really can be comparable.
And we also want to mention there are other machines in this area, but you guys are offering this for a cheaper price.
Right. We're actually the only practice offering it in Lynchburg, but you can go to Roanoke and Charlottesville, and our price is very competitive compared to theirs.
And of course, you know how to use this machine, but so do all the other physicians here, right?
Correct. So all of our providers here are trained to use the FemiLift machine. So if you're a patient of this practice, you can just call and talk to your own provider about it.
Sounds good. And do you need to see a consultation first, or do you start right off with it?
If this has been a chronic problem that you've already been dealing with your provider, you may just be able to call and set it up. However, if you've not seen your provider for it, or if you're new to our practice, we do like to see you in a consultation, make sure that this is the cause of your problem and that this would be the appropriate treatment.
Well, thank you so much for sharing this information with us. And to learn more about FemiLift vaginal treatment or women's health services overall, just give them a call at 434-239-7890 or go online to WHSCV.com. And we'll be right back.